Hello and welcome everyone to today's Utilizing Payment Tools to Increase Revenue for Your Practice webinar. My name is Jacob Workover here on the webinar team at Rectangle Health, and thank you so much for taking time out of your day to be here with us. We've got a great presentation for you today, and we can't wait to get into it. So before I send it over to Matthew, a few housekeeping notes here before we start. So if you are joining us on a mobile device today and you can get to a desktop, please do so. It is a better viewing experience there. Obviously, you can still join us via mobile, but if you have that ability, please do so. If you're having any technical issues or anything comes up during the webinar that you need support on, feel free to drop a question in the chat or question area, and we will be sure to get it taken care of for you. You can also email our support email at webinar@rectanglehealth.com, and we will address your needs as they come up. So anything tech issues, please just reach out to us, and we will be sure to get you taken care of. We are going to have a survey prompted at the end of the webinar. It'll pop up. It's just a few quick questions. Please, please, please fill that out for us so we know how we're doing and we can continue to provide the best webinars and content for you in the future. So make sure you fill that out. We will be sending out a copy of the recording and slides. So for whatever reason you have to leave early or you want to show this to your staff, you will be getting a follow-up email in the next 24 hours that's going to have all sorts of follow-up information, including the slides and recording. So always get asked that. We will be taking care of you on that. So make sure to look for that. We do have another webinar coming up that I want to make sure everyone is aware of. August 30th, it's a live HIPAA and cybersecurity training webinar with Terry McDonald, our Director of Compliance Solutions. It's a great presentation. I'm going to put a link to register in the chat so that you all have access, and highly recommend you join us for that. That's a 1.5 CE credit presentation. Really great course on all things HIPAA and cybersecurity. And lastly, we're very excited to be partnering with Visa for today's webinar. So our first 200 registrants who are also attendees are going to be receiving a $25 gift card. So if you are one of those people who qualified, you will be receiving an email within the next 10 days with information on how to redeem that. So don't reach out to us directly. We will send all the information to you if you're one of the people who qualified for that. So be on the lookout in your email in the next few days for that. And I'm really excited to be able to give a little prize out to everyone who registered early and is here today showing up with us. So that is my spiel. With that, I am very excited to pass it over to Mr. Matthew Morrobel. Matthew has been with Rectangle Health for over 4 years now and has worn many hats, including being a product delivery specialist, product training manager, sales training manager, and now he is one of the experts on our product marketing team. When it comes to card on file and all things payments, he's really your guy, and he is very knowledgeable of all things payments. So with that, I'm going to send it into you, Matthew, and go get him.
You got it. Hey, Jacob, thank you for that wonderful introduction. Really appreciate it. Jacob, you did everything for me on that introduction besides keep me honest on my shirt of choice. I forget how optically and aesthetically displeasing horizontal and vertical shirts can be. So I do apologize for everyone who is in attendance today. But I just want to say good morning to our folks in the Pacific, Mountain, and Central time zones, and good afternoon to our folks in the Eastern time zone. Currently, I'm located in Valhalla, New York. It's in Westchester County, about 30 to 40 minutes outside of the city. And just like that, as a typical New Yorker would do, we think the only city is New York City in the world. That's not true, but it's New York City, 30 to 40 minutes out. I do want to start off this presentation with just giving a little bit of context, and I'll get the agenda up here in just a second, but giving a little bit of context to who Rectangle Health is, what is it that we do, and what we're going to be speaking about today. To our first timers, welcome. If this is your first webinar or your first time really engaging with us here at Rectangle Health, welcome. And to our recurring folks, always a pleasure to have you. We do have some surprises as it relates to maybe some of our functionality in our tech stack, which we'll get into later on. But historically, Rectangle Health, we've been known as a payments company. We've been around for 30 years. This past April, we just celebrated our 30th anniversary. And when it comes down to what Rectangle Health is, even in our name, what's Rectangle Health? What does that mean? Well, think about your credit cards, your debit cards, your dollar bills, your checks, your laptops, your phones. The common denominator there is that they're all rectangles. So really, we want to make sure that your rectangles are healthy, Rectangle Health. But over the last couple of years, and I don't want to mention this early in our webinar, but COVID was a big catalyst to us really evolving our tech stack to be more inclusive of the patient journey and the provider journey. So not only helping providers get paid and maximizing the amount of ways that they can get paid and that patients can pay, but also taking into consideration the patient journey. So we'll talk a little bit more about that later on, but really what we're known for is our patented and award-winning innovative technology called Practice Management Bridge. Because really what it does is it helps bridge the front office processes to some of those back office roles and responsibilities and workflows as well. So Practice Management Bridge is our tool that you can, of course, take payments, engage with patients, and more importantly, take advantage of features like card on file. If you think about card on file, maybe a decade or so ago, it was something that was around, but it was still relatively new and there was some apprehension behind it. But over the past couple of years, we can't think of life and our lifestyles without thinking about card on file. And it's a really big thing as it relates to maybe gym memberships, Hulu, Netflix, Amazon. I don't even have cable TV anymore. All of my streaming services are digital apps that I have my card on file for those recurring billing services to take place. So it's really something that's been ushered in, not necessarily because of COVID, but when we think about the healthcare sector, that was a big catalyst, but it's something we've been utilizing way beforehand. And according to a completely unscientific, informal, and made up survey on my end, the coolest way to pay for anything is just to say, put it on my tab or bill it to my room. But the instances where you can actually do that are few and far between. But that's changed in recent years. And it is because of that surge in demand for contactless, frictionless, and just immediate payment options. And that's really what card on file gives you. Now, I know it might be difficult sometimes on navigating that conversation, but I always think being forthright and managing those expectations up front with consumers in the retail space or even our patients and clients in the healthcare space, you'll be surprised to see how many folks would jump on that bandwagon and leave their card on file with their trusted healthcare providers. So I'm going to go ahead and just take us into our next slide here and just go over our agenda. So what we're going to talk about today, I did do a brief introduction to Rectangle Health and Practice Management Bridge. There will be a demonstration later on card on file and how it ushers in some of our other features and functionality like recurring payment plans and memberships or installment plans. But we're going to talk about card on file benefits, use cases, having that conversation. There will be some polls thrown in for not only engagement purposes, but also to kind of gauge where we are at as a healthcare community and society in terms of card on file adoption, how we approach those conversations, what do we see as our inter-office benefits of card on file. That demonstration, like I talked about, and then we'll wrap up with some next steps as well, because as I alluded to earlier, we have really built out our technology stack to be more inclusive of your journey as healthcare providers, staff, and business owners, but also the patient journey as well. Let me move on to another slide here. So quick stats for us. 73% of providers say it takes at least 1 month to receive a patient payment. And that's when you think about revenue cycle management, being able to positively empower patients throughout any phase of care to not only make a payment, but also have that digital appetite, that technology appetite presented to them to let them know, hey, we're hip on times. We have features and functionality and engagement tools to let you know that we care about you. We understand that you're living the life, right? You're busy, you have kids, you have school, you have work going on. Well, let us send you maybe some reminders. Let us engage with you through texting, right? That same device that's attached to our hip 93% of the time, right? Being able to really kind of let folks know that we have solutions in place in order to create a better patient experience. And we'll talk about later what are some of those byproducts of having those features in place. But then when we look at this stat down below, 43% of patients say they would leave a card on file to automate payments. So nearly half of your patients and clients would leave a card on file. Now, the thing there is you don't get for what you don't ask for. So you have to position that conversation right off the bat. I actually just had my annual physical yesterday, and I booked this appointment about a month ago. And then about 2 weeks out, I received not only notifications and reminders on my appointment, but I was also able to leave a card on file with this provider, a new provider, and make my copay. And guess what I did? I left my card on file and submitted payments. And it's not only because I'm 32 years old, it has nothing to do with age demographic at the end of the day. Because even for folks like my grandmother, guess who's the one setting up those automated payments for her? It's me. And they're on Facebook more than I am. I can't even tell you the last time I logged into Facebook, but my grandmother's all over it. I don't even know how she has certain pictures of me that I don't have of myself. So that's a story for another time. But having that appetite, having that those functionalities in place, it really does shore up that patient experience. And you'll be surprised at the type of reviews that you'll end up garnering and being able to harness the power of positive reviews just by doing something simple like being able to text out reminders, being able to have a patient submit card on file right from the moment they set an appointment up with the practice. I know how in the healthcare industry, card on file has been maybe kind of on the back burner, and now it's at the forefront. And I do understand why. When you're talking about being able to be upfront with your patients and talk about fiscal and out-of-pocket responsibility, that can be something that's a bit unknown to a lot of patients. I mean, you ask me what my deductible is, I wouldn't be able to tell you. So I get it from a patient's perspective, why there might be some apprehension to leaving a card on file, but these are also the same people that we are entrusting to take care of our physical, mental, and emotional health at the end of the day. I think of myself as a consumer in the retail world. Prior to even booking a flight or booking my hotel, what's that entry ticket to being able to take advantage of a vacation? It's leaving a card on file. I even think about my hobbies nowadays. Yes, we talked about streaming services, but I'm an avid golfer, and nowadays it's no longer call the office to the golf shop, the pro shop, and just say, "Hey, my name's Matthew Morrobel. I want a tee time for this Saturday at 12 o'clock." They direct me online. They say, "Hey, well, you can go on our website, you can book a tee time. There might be a reservation fee, and sometimes you can pay for your round in advance." And the reason why they do that actually is to maximize revenue. You know why? Because if I don't cancel outside of a 24-hour window, they'll charge me for my round of golf, which can be anywhere from $40 to $150, depending on where I'm playing. And that's something providers can start taking advantage of as well, setting those expectations, having that card on file malleability, but also making sure that their seats and their calendars are staying filled. There were times, maybe 7, 8 years ago, I would see signs on my dentist walls, and it would say, "Hey, no shows, they're going to be charged a fee of $25." But they never had my card on file in order to charge me. So I'm gonna maybe get a bill in the mail. The times of sending out bills in the mail are long gone. Yes, there might be some patients that they still prefer that to be their preference, and that's okay, but we still need to digitally enable those patients who want those mailings to be empowered to pay online as well, whether it be a link, whether it be a text to pay, or at that point in time, allowing for patients to keep that card on file. So I'm going to go ahead and I'm going to switch over to another slide here now, and we're going to start talking about, again, those benefits which we already kind of hinted on. But card on file, it's secure, it's convenient, it's an effective way for providers to ensure prompt, immediate payment. Essentially, it's a way to have commitments to pay rather than promises to pay. And I know everyone here, all of our attendees would love to get paid rather than kind of waiting on the back burner in order to get paid. So what is it used for? Card on file can be used for those outstanding balances, especially to hedge against insurance balances. And we'll talk about our pre-authorized healthcare form here shortly, because that's something we've had in place for our 30 years of doing business. We've had pre-authorized healthcare forms that allow for transparency within the card on file process, but also ensure payments for balances not covered by insurance or for future visits and for recurring treatment that might be rendered to a patient. So outstanding balances is one way. Copays and delayed fees is another way. And then we just hinted on this, no show and late cancellation costs. being able to say, hey, well, you had the appropriate amount of time. We're sending you reminders. You could have given us a call outside of 24 hours. We know that emergencies happen. We get that. But as a provider who's also running a business, you need to ensure that you're getting paid as well. And that's where having that $25 or $50 late fee or cancellation fee can come into play and maximize revenue for the practice. And then being able to usher in some additional functionality with card on file, like recurring payment plans or memberships. For instance, with my chiropractor, I'm able to pay them $10 a month, and I can come in a couple of times a week. And what I'm able to do is use their facilities. They have a nice little yoga mat that I can go and stretch out a little bit. It's essentially like a little bit of a gym membership, but really just for kind of stretching, which is kind of cool, just for $10 a month. So that's something that I can do with my chiropractor. And then for future visits, for instance, I see my dermatologist on a monthly basis, and I have my card on file with them. So what I'm able to do is every time I go to my dermatologist, I pay my $50 with the card that's already on file. And what that ends up doing when you're talking about how it helps is it's that fourth block there. It expedites that check-in and check-out process. I'm that same patient, and I know I'm kind of coming off to be a little annoying at this point in time, and I apologize. But I'm that patient that I'm not going to sit around in your waiting room and fill out an actual clipboard. If there's not a digital way for me to fill out my clipboard material, I'm moving. That's actually what happened to my previous dermatologist. I had just moved around the area where our office is, and I was looking for a dermatologist. I went in, they had me fill out a physical clipboard. I said, I don't have time for this. Looked online quickly for another dermatologist, had an appointment the next day where I was able to submit all that information from the comfort of my couch. But how we help improve revenue cycle management, again, thinking about the patient journey. They call, they schedule an appointment, you get the insurance, the visit comes, they pay for their copay, they leave, and then you go through that balanced billing cycle. And as we just talked about, 73% of providers says it takes at least a month to start seeing payment. So we want to help speed up the balanced billing cycle with card on file. And then check this one out, reduce chargebacks. So this is something that's unique to not only Rectangle Health, but in particular Practice Management Bridge and the way that we use card on file, which by the way, folks, we call it vaulting. We know that in the past, especially in the retail environment, card on files had some negative connotations attached to it. We call it vaulting because it is a secure vault. And we'll talk about some of those security measures that we take in place here shortly. But we reduce chargebacks by having that pre-authorized healthcare form that a patient signs, and they assign, of course, their insurance to us, and they leave their card on file with us. But it's a form that they sign, and it's actually a digitally enabled form now. It used to be a physical copy that we would leave with practices. But that helps to reduce chargebacks. And we haven't lost a chargeback in our 30 years of doing business because we create visibility and transparency within that payment process, and especially leaving that card on file between the patient and the provider. We talked about expediting check-in and check-out processes, and then of course for future visits and family plan payments. Thinking about pediatricians, right? Sometimes you might have the grandparents after school taking the children to their visits. Well, you have the parents' card on file, which is a really good thing, right? So that the grandparents or the guardians don't have to necessarily dig into their wallets and submit payment that way. There's already an automated way in place to satisfy that payment. But just again, monthly installments, delayed fees, no-show and cancellation costs, recurring fees, and how it helps in essence is it saves time, it helps reduce late payments, and it improves security measures. And what are those security measures that I kind of hinted towards? Well, it's us being SOC 2 certified, which is the highest level of compliance you can have in cloud computing. It's us being, of course, PCI compliant, payment card industry compliant, DSS. It's us being HIPAA compliant, right? It's also us being able to have that card encrypted. And I know encryption might be something that we might have to explain. I'll show you later on. But that card information is encrypted. So staff members can't access that card once it has been vaulted. And also we do use omni tokenization. So when a patient is initiating that payment process with a card terminal, their card number is actually masked. So it's not asterisked out like encryption is, it's actually just masked so that the numbers are just all fake numbers. So you're not able to grab at that actual card information. So that's how we kind of use security measures and compliance in order to shore up that card on file process. So I know we've taken some time here. Hey, Jacob, do you mind just queuing up one of our polling questions for us?
Let's do it. All right. All right. If you are currently utilizing card on file or plan to in the future, at which stage of care do you envision engaging in that discussion? Is it pre-care, point of care, post-care, or at other stages of the patient journey? I'll give everyone a few seconds to get in those answers there. All right. So it looks like we had 36% say pre-care, 30% point of care, 26% post-care, and 8% at other stages of the patient journey.
Oh, I'm really curious to know what that other 8% is. But quite frankly, everyone who answered that question, they are correct. At every stage of care is the perfect opportunity to talk about card on file because every patient's different. You know, some folks might want to see what their out-of-pocket responsibility is. So maybe that might be post-care, giving them that convenient route to say, okay, well, I know what I owe. Maybe it's $200, maybe it's $100, but I might need some payment flexibility at that point in time. So let me leave a card on file in order for the provider to then break down that payment over time. Maybe it might be pre-care. Again, I'm that type of person. I trust who I'm seeing. So why not leave that card on file pre-care? And if I can even satisfy my copay before I go into the visit, guess what? That's a minute or two that I can save because most likely there's someone in front of me, as there was yesterday. Luckily, I was only signing in and then going for my lab, so I just had to sign in quickly for my lab. But there was already someone at the counter, so it will be easy for me to save that time and to just focus on some other things. I was still doing some work and even prepping for this webinar rather than having that 2-minute transaction process take place. And then think about that. Take a step back and think about that, folks. If we're able to save a minute or two and you're seeing, let's say, 20 to 30 patients a day, that could easily be 20 to 30 minutes that we can save by just having a card on file. Guess what we can do in 20 to 30 minutes? See another patient. And that's how we truly maximize revenue at the end of the day, right? It's not only being able to capture those copays ahead of time and collect in full during the balance billing cycle, but what can we do to also maximize our time with the patient and not be doing some of these manual processes? So that's great. Going to mention Charles Mingus here, one of the great 20th century jazz composers. Making the simple complicated is commonplace. Making the complicated simple, awesomely simple, that's creativity. And that's what we pride ourselves here at Rectangle Health. It's being able to make the simple possible and the simple easy. And right from when I start demonstrating Practice Management Bridge, which I'll get into in just a short while here, it's a simple, easy to use interface. You don't need much training. And if you need training, there's a resource center on the bottom right-hand side to endow our end users, our providers, our staff members, our partners at the end of the day with resources in order to understand what they're doing from not only a payments perspective, but from an engagement perspective and from a best practices perspective. So I can show folks where that is afterwards. And by the way, we also have dedicated 24/7 support for you. So whether it's Christmas night, whether it's Easter morning, we have folks on standby, real human beings ready to talk to you, whether it be by chat, by phone call, or even by email or remote support. We have folks ready to tend to your needs and help you any way possible. That's our commitment at the end of the day. That's also something that sets us apart from other companies. It's being able to truly engage and be involved in this partnership with our providers. And our technology is built off of the backs and the feedback of our providers. So even if we don't have something today, guess what? We have the backlog. Our development and product team are working hard in order to ensure that our technology meets your needs and your demands. So we talked about where we're engaging in that conversation: before the visit, at the visit, after the visit. So pre-care, point of care, post-care. Pre-care, what we're able to do with Practice Management Bridge is that we're able to, during the registration and intake process, we're able to keep a card securely on file right from those intake forms. And currently, we do have 3 types of forms. It's a medical registration with card on file form, it's a medical registration only form without card on file, and then there's a card on file only form. I know maybe tons of our providers here already have intake forms at their disposal, digital ones at that. That's okay, but just ensure that you also are taking advantage of card on file during that process as well, because that's a great way for folks like me and maybe even Jacob on the line to leave our card on file and to expedite that process. And again, kind of feed upon that technology appetite that we have nowadays. But you can also do that over the phone. Doesn't necessarily have to be through an intake form. You can also do it over the phone. You still might have some patients calling the practice, looking to see availability and booking their appointment that way. That's great. By the way, would you also like to leave a card on file in order to create that convenience for you? At the visit, patients can, insert, swipe, or tap their card into our payment terminals. And by the way, those are Ingenico terminals, up-to-date terminals that they take NFC transactions. That's the near field communication, tap to pay. They can swipe the MagStrip transactions, and then EMV, the inserting the card. We can take all 3 forms of those payments at the point of care. You can also leave your card on file during that process. So while you're taking that transaction, patient Matthew Morrobel, would you also like to leave your card on file? We have to book your appointment out 6 months, or maybe it might be recurring treatment for next month. We can do that simply. And then after the visit, still being able to provide that intake form. So it's not necessarily an intake form, but it would be that card on file only form that you can send out via email to patients or even text it out to patients as well. Or if they're going to go through the mailing cycle in terms of getting maybe a stub in the mail and then sending it back to you, you can also leave that note and even a pre-authorized healthcare form to say, would you like to leave your card on file? So at any stage of care, you're able to provide that flexibility, that malleability of card on file, and engage in those conversations. And there's no need to be shy of that conversation. It's something we honestly expect in today's day and age. So benefits of card on file, we talked about this earlier, how it helps, but just to kind of, give ourselves a little refresher, and then we're going to go right into another polling question and then the demo to really wrap us up. And by the way, if there's any questions, please feel free to put those into the chat for Jacob. I'm going to go ahead and answer those as well. And even Jacob, if you already have some of those questions coming in, happy to answer some of those as well in our next polling section that's going to happen in a couple of minutes. And I'm also sure that there might be some questions coming in during the demonstration within Practice Management Bridge. So don't be shy, give us your questions. And if this is functionality that you want, that you don't have, at the end, I will have a little call to action on a phone number and an email you can reach out to in order to garner and gain access to this functionality for card on file, recurring payment plans, and maybe even some of our other tools, our engagement and compliance tools. So, hey, benefits, enhanced patient convenience. We all have particular lifestyles now. Please ensure that you are providing card on file flexibility to your patients. You'll be surprised at how many patients would leave a card on file with you. It's secure. Oh, and by the way, we post payments, those card on file payments, into any EHR, electronic health record system that you might be using, EMR, electronic medical record system that you might be using, or practice management software that you might be using. We are starting to come out with integrations as well so that we're embedded within those EMR, EHRs as well, but we can at the very least interface a payment, which is act as a keyboard for your front office staff so that you can maximize time with the patient, engaging in conversation, building your rapport with your patients rather than going through that payment process and then maybe at the end of the day or after that interaction having to manually type in those payments into the patient ledger or account. So enhanced patient convenience, more time, faster payments and fewer bills, being able to shore up and digitize that billing process a little bit, right? We saw earlier that 43% of patients would keep a card on file. Well, what would you do with 43% more payments taken within that 30-day balanced billing cycle, right? That would be a beautiful thing. So, and then more accurate payments as well. If you're anything like me, some of the folks here at Rectangle Health will tell you, I can't type for anything. So I wouldn't be able to even work at a practice. I'll tell you that right now. Um, I'm awful. So I'm always kind of hitting my H's with my G's and my 2's with my 3's. So being able to have more timely payments and more accurate payments, that's what it's all about. Improved security, like we mentioned, that point-to-point encryption, also called P2PE, tokenization, being able to mumble and mix up those numbers so that you can never get to the real number, SOC 2 certification. All of these help ensure and create that environment of peace of mind and tranquility when it comes down to being PCI compliant and keeping those cards on file, and just ushering and fostering that environment of digitization, automation, and streamlined capability. Talking about streamlined capabilities, thinking about administrative processes, less phone calls, less mailings, less emails, more payments, and more payments at the end of the day, more automated payments and more time means more care. And that's what it's all about for you folks. I know it. You want to be delivering excellent care to your patients, and you can do that. Enhanced revenue management. So thinking about revenue cycle management. I know some folks here might have RCM consultants or technologies in place. That's fantastic. Make sure we're utilizing it. Even if it's not us and it's someone else, please ensure that you are maximizing all the possible ways to increase cash flow, be equitable, be profitable. And still maybe recoup on some of that lost revenue throughout COVID. I saw something from the American Hospital Association that it was upwards of $202 billion that was lost throughout COVID, that affected the healthcare industry. So we might still be trying to balance out the scales. Well, let's make sure that we have these technologies in place to help us out. And then, of course, my favorite, and I know it's true and dear to our hearts, we've been talking about it, patient and staff satisfaction. Let's talk about the staff now as well, because the more automation we put into their hands, the easier their job is. And I used to be a part of, implementing our solution for providers. I know how it can be. You folks are wearing 27 different hats. You have so much going on. The more that we can put automation into these folks' hands, it boosts staff morale, it boosts productivity, and it keeps those referrals rolling in and being able to harness that power of positive reviews. So with that, I'm going to go ahead. Jacob, if you don't mind, let's throw up this last poll. I'm going to show you what that pre-authorized healthcare form looks like on screen here, but then we'll dive into it in our demo that's coming up in just a couple short minutes. Thanks, Jacob.
All right. As we know, card on file can help in many ways. What card on file impact means the most in terms of priority for the practice? Increase cash flow and profitability, boost staff morale and productivity, patient convenience and satisfaction, or other? Let's get those answers in. All right. Looks like we had 48% say increase cash flow and profitability, 25% say boost staff morale and productivity, 23% with patient convenience and satisfaction, and 2% with other.
I really wish we can get that other to be a fill-in section, Jacob. I'm curious to know what's out there and what we're thinking. But thanks for that. Really appreciate that. And as nearly half of the folks said, increase cash flow, recoup on some of those outstanding balances, digitize the balance billing cycle, get more timely and more accurate payments. That's a beautiful thing. But also, it's all about our staff at the end of the day as well, because when we talk about patient satisfaction, guess where that gets disseminated down from? The staff, the provider themselves as well. So that's really important. All right, folks. So with that, I'm going to go ahead. I know we're almost at the half an hour mark, yep, 12:33. So let me go ahead and get us into practice management bridge. Now, I know there might be some first timers on the phone here, so I'll make sense of what you're seeing on the screen. And for some of our folks who have recently been onboarded or have been with us for quite some time, it might not be nothing new to you. But we can talk about some additional functionality that's been implemented over the last couple of months and some other things that you can do, and maybe some other ways you can keep a card on file. And if it's something that you don't have, again, there will be a call to action at the end for some folks you can reach out to in order to gain access to that functionality, or maybe even tack on some additional solutions and functionality as well. So let me go ahead here, switch the screen share here. Practice management bridge, and then Jacob, keep me honest. You know, this format, this technology is actually new for me. I'm hoping you can see the practice management bridge interface here.
Yeah, we see your login page.
All right, beautiful. So folks, Practice Management Bridge, it's accessible, it's malleable, it's web-based. So I kind of have it just saved as an icon on my desktop, so I don't have to go into Google Chrome and then go to my bookmark section and then sign in. And this is most oftentimes how we implement our providers as well. Kind of just dropping ourselves as an icon on their desktop. And I know some providers have 20,000 different things going on their desktops. I've seen it. I even have some colleagues who are like that. But we try to make it easy for you. So we can save it on your desktop. We can save it on your taskbar down below, or you can have it bookmarked on your Google Chrome. We work on any web browser, Safari, Google Chrome, Edge. Sadly, Internet Explorer is not a thing anymore. That's okay though. Google Chrome and Safari can be just fine. And of course, Edge and Firefox as well. So what I'm gonna do is I'm gonna go ahead and sign in. Now I do wanna give a little disclaimer here. There might be some functionality on my screen that you might not have access to, but that's okay because you can give us a call, you can shoot us an email, and you can find out about how to implement some of this technology. So on the upper right-hand side, you'll see that I'm connected. I am connected to my Ingenico Lane 7000 terminal that does feed on NFC transactions, that tap to pay, EMV transactions, that insert to pay, and then the swipe transaction magstrip, you know, being able to swipe that card at the point of care. I am in the office today, so I do apologize for any background noise. Of course, this is the day where all of our hybrid and work from home folks wanted to come in, but that's okay. We'll chalk that up to the game. But you'll be brought to this payment screen initially. And what you can do is take those payments for patients who are calling over the phone, or for patients who submitted their information through the mail, because that is still a thing, I know. Well, you can click on that credit card payment. You can fill in that information here, which I'll just do quickly for us. I have a $25 payment. Of course, you can run the payment, but right down here below, you can add that card to the vault. And then what's the vault ID? Well, essentially, it's just a naming convention for those cards that you're putting on file. Now, I wouldn't put maybe Matthew Morrobel, even though it's a unique last name. If you're dealing with, let's say, you know, Tim Parker, there might be a couple Tim Parkers that you serve. So the vault ID, I like to just, you know, maybe mention to our providers, our partners, that maybe you might want to make that the medical ID number. Maybe you might want to make that the chart number, the patient ID. Because that's something that's unique to the patient, right? It's just like our Con Edison accounts, right? For our electricity or any other type of subscription, we have some type of identifier that's unique to us. So that's what I would do. So I can do something like this. I can say that this is my patient ID. And now what's this maximum amount? Well, you can always put 0 so that we just have the card on file. But if it's gonna be for maybe ongoing treatment or more visits this year, if you know that the recurring amount is $50, a copay, maybe you're a specialist, right? Mentioning my dermatologist, you can put $50 or for all visits this year. So every time a patient comes in now, they know that there's an agreement in place for $50 a pop. Or you might have a patient who might wanna satisfy the $600 upfront. You can have that flexibility as well. Or again, it can only be for this visit. Maybe you're hedging against insurance balances, right? You've done your best to estimate what insurance is going to cover, but you know how insurance companies can be. You know how that process works out at the end of the day. I know, major pain point. We're looking to help in that regard as well. We actually just recently partnered with Zealous on the payer side in order to streamline some of those processing mechanisms as well. So please give us calls later on, inquire about what we have going on here at Rectangle Health. It's a beautiful time to be a partner of ours. But for right now, let's just say it's $50 for this visit only. So if insurance comes back and I still owe a balance of up to $50, I'm letting my provider say, hey, don't bother me with the phone call. Don't shoot me an email. If you want to send me a text, yeah, sure, you can send me a text and let me know that you're going to charge my card. But I already am giving you the permission to charge my card up to $50 if insurance leaves a balance for this visit. That's my copay. And this is for, again, for any balances after the fact. I can press submit. And of course, our technology will let you know if you have multiple locations, please attribute this payment to the correct location. So I'm going to go Southbury. Just like that, we're taking a payment of $25 in the system. We're generating on-screen proof of payments. There you go. This is the receipt that you can send off electronically to your patients. You can also print it out as well to your nearest printer. But the next page is going to be that pre-authorized healthcare form that we were talking about. And basically what that's saying is I, the patient, give the provider permission to leave my card on file and to charge me up to $50 if insurance leaves a balance of up to $50 within that 90-day window. So what that's going to do is help digitize and help automate the balance billing cycle, help our providers get paid, and it's easy to use. Once you learn how to use the system and you're fluid in the system, this is stuff that takes minutes to do. I can show you what that looks like on screen right here. I authorize the practice to keep my signature on file and charge my card ending in 1111 for the balance of charges not paid by insurance within 90 days of the date of service to not exceed $50 for this visit. And we also talked about being able to, during the intake process, leave a card on file. This is how you would do that. You can send this out via email or via text, and a patient can leave their card on file right from their phone, mobile devices, or iPads or tablets. And that pre-authorized healthcare form is built in here as well. And no, we're not going to charge them $1,000. This can be preset during the implementation process for the practice. It can be $0, your typical copay of $25 or $50. But a patient can quickly leave their card on file and know that it's a secure way to leave their card on file. So going back into the technology, now where does that card on file live? Well, it's going to live in our vault because that's what we call card on file here. We call it the vault. So I can, of course, search it by vault ID. And that'll populate in my search result composite right down below. There it is, nice and quick. But I can also search for the account name. And if I filled out some of the additional information on the prior screen, I'll make sense of it in just a short while, the patient account number would be there because that can differ from who's actually paying for the patient, right? Again, thinking about pediatrics, the patient name and any notes that are significant here. So let me forget about Vault ID. Let me search up by name. So Matthew Webinar, does Matthew Webinar maybe have multiple cards on file? They do, right? And this is the particular naming convention because I did mention earlier, we want to use maybe that patient's patient ID, medical ID, or chart number to keep that card on file so that it's unique. Well, since that number is unique and we just want to add multiple cards on file, we can just use some type of a naming convention like -1, -2, -3, -4, or we can use -MasterCard, -Visa, right? Who again is sponsoring our webinar today. Thank you, Visa. Or we can use -Discover. You can also utilize what we call some of these additional information fields or our provider defined fields because the provider lets us know what fields they want for reconciliation or categorization purposes. There you go, have my patient ID in there, the patient name and the notes. This card is going to be for outstanding balances. Maybe one card is for copay. Maybe another card is the family card, all right? So you can do that quickly. Something new over the past couple of years, we've had it before, but we used to have an application-based practice management bridge. Now we went web-based back in 2020, but you can now delete these cards if you need to. You can delete card on file. You can always edit the card on file as well. Maybe that card was lost, stolen, or expired, which by the way, I do want to mention something there. We do have card accounts updater. So CAU, card account updater, so that if a patient's card is lost, stolen, or expired, as long as they remain with the same bank, that card would be updated on the back end. Now, that's something that was also kind of recently implemented going back to just last year. So if you are a provider who's been with us for longer than maybe a year or two, you can call in, inquire about card account updater, and we can go ahead and get you going with that. Right? And that's included with your practice management bridge, but there's a little activation on the back end that would need to take place. If you've recently been onboarded or you're new to us here, because we do have some first timers, that's something that we do for you. And you might be familiar with that. Let's say like if you're using like an Amazon or a Netflix. I know it's happened with me in the past with Amazon. I had my Chase card. I had to get a new Chase card and it just updated automatically in Amazon for me. So you can, of course, delete cards, edit card information. I can just take you quickly into what that interface looks like. You can edit that card out, change the expiration date. You can also even change that amount that's been pre-authorized by the patient, and that would just create a new pre-authorized healthcare form. Since it is a web-based interface and a web-based technology, you can always use the back button and get back to that prior screen. You can search for the Matthew webinar results one more time. There you go, instantaneously it pops up. You can always export this information into an Excel spreadsheet should you need to. And let's talk about being able to run those payments, of course, right? Talking about being able to kind of automate that billing cycle and then usher in some additional functionality like payment plans or memberships or installment plans. You can run payments by quickly clicking this kind of clearinghouse icon, I like to call it, under run payment. That'll take you to this interface. If you have multiple locations, you can direct that payment to that particular location. If you only have one location, that's fine. It's always being routed to the correct bank account. Or maybe you're one location that has multiple practices within inside. Well, you can direct which provider or which practice inside that location it's going to. So let's say it's for Southbury and it's going to be a $25 payment. There you go. In 7 seconds, you've been able to take that payment. Especially if you have that pre-authorized consent by the patient, there it is. And if you're utilizing our payment posting technology, this would just take that information and just automatically type it into your EMR or EHR. And if you are, using at this point any EagleSoft, if you're using NextGen, if you're using Open Dental, we do have those integrations in place. We have an API integration with Greenway as well, and we're coming out with more integrations this year. So be on the lookout. We have Dentrix Desktop coming out, Athena coming out as well. So we do have some payment integrations that are going to be surfacing. So definitely feel free to check us out online at rectanglehealth.com. Follow us on social media. That'll also be a call to action at the end as well. So I can go back. I just want to search for this one more time, and let's talk about, I know we're getting towards 12:50. Let's talk about recurring payment plans, because this is something that's been big for me and I take to heart. I did mention I'm 32 years old, sorry for aging myself, but a couple years back in 2020, so during COVID and everything, I experienced some physical ailments that required some procedures to be done. And again, not totally understanding what my insurance is going to cover, but needing the help, I had to come out of pocket for $4,237. I'll never forget, because at that point, I'm living in New York. I'm paying a $1,600 rent. I'm paying for my car. I'm paying for insurance. I'm still paying off student loans. I had a lot of fiscal responsibility working against me. And for me to shoulder out $4,237, it was a lot for me. And I shouldn't have to go into my savings as a patient or even as a consumer in order to purchase something. I should be able to, maybe use my credit card, but not have to pay that back by the next billing statement, which would be next month, which I wouldn't have been able to do. I should have been given that flexibility in order to break that down over time. And luckily, the provider that I was seeing, and it is an enterprise provider. It's WestMed, who has multiple locations here in Westchester, New York, Westchester Medical. I was given that flexibility. And guess what? It not only made me a happy patient and a satisfied patient, but I referred 3 other folks to the practice as well because of that flexibility and for them taking me into consideration, because that's what it's all about today. It's about being considered in today's environment. And I do take that to heart. So being able to provide recurring payment plans with a click of a button, hey, Matthew Morrobel, you owe $4,237. You get paid biweekly. Okay, so that's going to be 26 payments, right? Thinking about a yearly calendar. You get paid biweekly starting on this Friday. Well, we can set that up just like that. And there's malleability here as well. Every 3 weeks, every 4 weeks you can do, right? But for me, it was every 2 weeks. And then look what it does. It does balloon that first payment to be 187. This is exactly what happened to me. And then I had 25 remaining payments of $162. So now when I'm getting my check from Rectangle Health, I'm able to then not have that fiscal burden of thinking about the $4,237 I owe, but rather knowing that a comfortable 162 is coming out every 2 weeks. And that's okay. So you can go ahead and submit that through, just like we did with our transactions, attribute that to a location if you have multiple locations. And just like that, you can confirm what's going on with that payment plan and what it's gonna do. It can ask for a signature, which I can provide right here through my Ingenico terminal. You can also click no signature if the patient is, not in office, but this is gonna get that electronically captured signature on the pre-authorized healthcare form. So that's the beauty about it. Sorry for my squiggle, folks. And again, this is going to help with chargeback protection, help with creating visibility and transparency into that card on file process and into what's owed. So that's going to be huge as well. So that's all there, folks. Let me just go, I'm so sorry. Let me just go ahead and get this out of the way. Now I can close out of there. And you can manage your cards on file by just simply clicking search. It'll give you a composite of all the cards you have on file. You can use any of these fields to search for cards that are on file or vaulted cards. You can go into the recurring tab. You can search for any active payment plans you have going on, any inactive payment plans you have going on. You can search by location, of course, search by patient name or card holder name. You can export all of these payment plans into an Excel spreadsheet so that you can actually have visibility into what's still to be collected, right? What's your current state versus your desired state with what's still out there in terms of payment plans. And we'll give you that in a nice, easy to read kind of Excel spreadsheet, a nice composite for you to understand how many payment plans you still have out there, what's the average of each, and then what's still to be collected through these payment plans. And again, if a card is lost, stolen, or expired, we have card account updater as long as they're remaining with the same bank institution for us to have those, create less friction within that payment process. I did mention the Resource Center a little while back. We do have the Resource Center on the bottom right-hand side, something it's kind of new over the past year or two. We have some onboarding tutorials. We have, of course, patient financing resources, patient financing, something new with the company over the last year. So if you would like to understand what are your options for patient financing, give us a call. Even if you're using Care Credit or you're using Sunbit or if you're using any other service for financing, come see what we have going on as well. We might be able to give you either more competitive rates, but really give you everything under one vendor, which is consolidation at the end of the day, which our folks are loving. There's some product updates, so anytime that there's any enhancements to our technology, we keep you up to date with what's going on. From an end user perspective, there's guides and best practices, feature walkthroughs, and then being able to share your feedback. I told you that we evolve our technology based off the feedback of our end users and our providers, our partners. So please give us your feedback. And if you need 24/7 support, we got you covered right here as well. Being able to quickly get support right through the interface. Patient Express, of course, is where you can send out text to pay. So if you don't have Patient Express capability, give us a call. I'll get that screen up for us in just a second here. We did mention patient financing. Balance Collect is being able to import list of what's owed from your patients, quickly see what they have owed, and then you can send them out text to pays as well. Also provides bulk texting capabilities too. So that's something that we can do as well. We also did mention, appointment reminders. We mentioned being able to help with your reputation and getting more Google and Facebook reviews. We also mentioned OSHA, HIPAA. Well, I didn't mention OSHA. I did mention HIPAA compliance, though, and PCI compliance, but OSHA compliance as well. Through M&A, through mergers and acquisitions recently over the last couple of years, we've brought on some amazing companies, and we're just now Rectangle Health as a whole, which is a beautiful thing. But they have some incredible functionality, thinking about provider compliance through Office Safe, our technology, thinking about reminders and scheduling capabilities through Rave Points and Reminder Call. We're going to be actually offering all of this in one simple to use interface, Practice Management Bridge, coming soon. So that's going to be big for us at the end of the year as we're really kind of building this culture of inclusivity. So that's on the way, but give us a call. See what we have going on here at Rectangle Health. It's a beautiful time to be a partner of ours. We really do appreciate it. And let me just get back to the presentation here. I think I should be good there. No more polls. I know we're all polled out. I know. We saw the demo. And this is our call to action. So if you have any questions, if you want to learn more about the Vault or learn more about recurring, you can email customersuccess@rectanglehealth.com. If you do want to add on functionality, you want to learn more about what we have to offer in terms of our tech stack now with some of these other solutions that we're now offering when you think about engagement or compliance, you can email salesleads@rectanglehealth.com or simply give us a call at 615-241-2685. And feel free to also give us a call on our 800 number, 1-800-337-3630. You can get that right online, from Google when you search up Rectangle Health. And then speaking about Rectangle Health, rectanglehealth.com. You can also search Rectangle Health on Facebook, LinkedIn, Instagram, G2 reviews, and Google reviews. With that, Jacob, I know I've talked enough. I can keep talking for another couple hours, but I know these folks are busy. We've already wasted enough time. Go ahead, Jacob. Anything else?
I think you should talk for about 3 more hours if everyone has the time. Just kidding.
Really appreciate it.
Matthew, thank you so much for presenting today. Before everyone pops up, just a few quick housekeeping items. As mentioned before, there will be a survey that generates when you leave the webinar. Please fill that out so we can know how we did and make sure we're providing the best content to you in the future. As mentioned also before, we're going to be sending out those $25 Visa gift cards. So you will receive an email in the next 10 days with information on how to redeem those. So don't reach out proactively. We will make sure we get you all the information if you are someone who qualified for that. As Matthew mentioned, a lot of great stuff with Card on File, Practice Management Bridge. If you would like to move forward with using Practice Management Bridge for your practice, if you haven't already, I've put a link to sign up for a demo in the chat, so please fill that out. And if you're a current client and either need help with Card on File or you're not presently using Card on File, I'm also going to put links to that phone number and everything Matthew just went through so that you have access to that as well. We definitely want to make sure you're taking care of that and using all the tools you can possibly use to help increase revenue for your practice there. We will be sending out a follow-up email with recordings, slides, all that fun stuff. So if you want to share with anyone else from your practice, you can. And then one more reminder, we'd love if you joined us at our next webinar on August 30th, HIPAA and cybersecurity training. It's a great CE course. We recommend everyone in the staff goes. It'll be refresher training, new updates. You'll complete an annual risk assessment. There's a lot of great stuff going on in that class, so please make sure to join us. With that, that's all I have. Matthew, I do have 2 or 3 questions in the chat here, so you guys can feel free to pop off if you're someone who asked a question. I'll have Matthew answer a few of those now for the next 5 minutes, and then if we don't get to your question, we'll follow up in the next 24 hours here with the email response to your question. So, all right, Matt, I'm going to hit you with a few questions here.
You got it.
All right, does the program also include flex spending cards?
Flex spending cards. So when we're talking about HSA and FSA cards, yes. For flex spending, that is something that we would just need to inquire more, dig deeper into. So if you don't mind giving us a call into our customer care team, we'll be able to handle that. But HSA and FSA, we do. So flex spending accounts, we do. I know that there's some other cards out there as well, but yeah, just give us a call.
Cool. All right, if we're a current client of Rectangle Health, how do we handle when a client cancels their card on file without notifying us?
Oh, that's a great question. So if a patient cancels their card, what we'll do is we'll try to charge them again. There is some recharge logic at the back of setting up payment plans that you can inquire about with your implementation specialist or with our customer care team. But we'll try to charge that card again, and then we'll flag it within your transaction reports to say it declined and for a particular reason, because there's either insufficient funds, it is a card that was lost, stolen, or canceled. And then what we'll be able to do is re-engage with that particular patient, either through text messaging, if that's enabled on your account, or with a phone call, of course, by your practice, and then get another card to then put on file. I hope that answers your question. And if not, feel free to contact us and I'll be able to help you out.
Perfect. All right, moving down the list here. Are you able to edit the Vault ID field?
Ooh, that's a great question. So currently you're not able to, but that functionality is coming out. But and the workaround for that is if you need to, let's say if you're like me and you kind of hit another key that you weren't supposed to, you can just use the actual Vault ID then, or you can, if you use the Vault ID and you want to supplement it with something else, you can use kind of another naming convention.
Perfect. All right. For the payment to post, do we need to have the patient ledger open?
Yeah, so for interfacing, yes. So if for interfacing payments, which we can do into any system, it doesn't matter if you're using an Excel spreadsheet, if you're using a notepad, Allscripts, Epic, Dolphin, the patient ledger does need to be open, because if you have 17 patient ledgers open, we don't know which one to go to. So it's the last one that you highlighted that payment's going to be syncing up into. And even if you go into the wrong patient ledger, the worst thing that happens is that you just delete that payment from the wrong patient's ledger. You can go back to transaction reports. It's going to be your latest transaction, and you can just click to post into the correct ledger. But yes, that patient ledger, the correct one, does need to be open in order to satisfy that payment posting technology.
Perfect. All right, well, looks like we're approaching the end of the hour here. I still see some more questions. We're not gonna have time to get to everyone. So if you had a question that wasn't answered, we will follow up as soon as we can with an answer to that for you and make sure that you're taken care of. But with that, I wanna thank everyone once again for being here today. Matthew, thank you for a great presentation. This was really informative. I'm seeing a bunch of people popping up in the chat here, thanking you and saying you did a great job. So that makes me feel good. But with that, everyone, have a wonderful rest of your day. Thanks again for joining us, and we'll see you at our next webinar. Take care.
Thank you, everyone.